begin our meeting by introducing our speaker. You may already know, but we will repeat for those who are not sure who Dr. Tizin is. Well, his professional curriculum is immense. His Spiritist experience is so broad and large, but we're going to summarize it just so we picture how fortunate we are tonight. And we are not sparing mere words. We say it from the heart. Dr. Tizin is, professionally speaking, he is a physician. Especially, his specialty is cardiology, which is good. If you have heart problem, you're safe tonight. So, he's a cardiologist, and he practices it in Rio de Janeiro, Brazil. He also has a degree in physics. Can you believe it? Yes. He also teaches different subjects of medicine to medical students in Brazil. And he has a special appointment with the Minister of Health in Brazil. As a Spiritist, he was born and raised in a Spiritist family, a quite unique one, because his father, the renowned Francisco Tizin, was one of the most, let's say, memorable presidents of the Brazilian Spiritist Federation. Francisco Tizin was president of the Brazilian Spiritist Federation for 15 years. And he was actually the one that had close relationship with Chico Xavier, so much so that they exchanged letters. And some of these letters came about in this book that is not in English yet, but I've mentioned this to you. Testemunhos de Chico Xavier, written by Sueli Caldas Schubert. And there you can tell the nature of his integrity, his very disciplined mind, and his love and devotion to the cause of Spiritism. Dr. Tizin on his own, though he was born in a Spiritist family, he chose to also be a Spiritist. Because some people think, oh, your father's a Spirit, then you'll be a Spirit. Not necessarily. He made a choice as well. And he founded different groups in Brazil as he traveled and lived in different areas. But he coordinates directly to specific groups in Rio de Janeiro. He also writes for Spiritist magazines in general in Brazil, especially the one that is related to the Brazilian Spiritist Federation, which is entitled The Reformer or Reformador. He also is an international speaker that kindly travels many times with his own resources to benefit groups everywhere and elsewhere. Not only in the United States, Canada, Mexico, South America, Central America, but also in Europe, Australia, and certain areas in Eastern Europe, like Poland and Yugoslavia and others. So you can tell he has a very broad experience. He has a lot of interesting things to teach us. And of the many things we thought, for the first time he comes to visit us, let's talk about one of the most critical issues for all of us, which is depression. Because that's what we probably need the most on earth. Right? You agree? And in that tone, would like to ask you to receive him at the podium with your kind and loving hug, so he can begin the teachings of the evening for us, okay? So please, Dr. Tizin, Sergio.
Hi everybody, ladies and gentlemen. I will try to do this lecture in English, but my English it is not so fluent, but I will try to do it with the help of my friend Vanessa and the help of all of you. Okay? Depression, we can see now in the world like a very important problem, a medical and social problem, because we have many cases all over all over the world. We consider now, like a doctor, a physician, depression like a big epidemic problem, because we have many cases in every country, in every continent, and in the United States and in Brazil we have a very important impact of the depression problem. How we are Spiritists too, beside the idea of working in medical work, we can see the idea that we have one word with very important moral problems, and when we treat and when we care of the patients with depression, we can perceive the moral problems of our world. So we can see the idea that to relate the psychiatry diseases, including depression, with our moral situation, individually and in terms of our whole humanity. So we can do some kind of linking between the spiritual imperfections of ourselves and the problem of depression. Another aspect that we have in our world, one big era of materialism, and we are looking the change to another and very important change in terms of the era of the spirit. But we are leaving this problem nowadays, and we are leaving the heritage of the moral problems. We can see depression in two terms. We can see it like the idea of one change of mood, but here we are dealing with the idea of major depression, a big psychiatric disease. We can use the idea that major depressive disorder is a disabling condition which adversely affects a person's family, work, or school life, sleeping and eating habits, and general health, including sexuality. In the United States, around 3.4% of people with major depression, this problem, commit suicide. And changing the idea, and up to 60% of the people who committed suicide had depression or another mood disorder. This is a linking between another big problem, that is suicide. Here we can see the world map, and we can imagine the problem around the world in terms of unipolar depressive disorders in a few years ago. So we have United States and India, the two important countries where we have the most important incidence and prevalence of the disease. But we can see in Canada and in all South America the same, because in this map we can see the spreading of depression all over the world. But in United States of America and India and in Brazil we have maybe some kind of more important impact, because incidence and prevalence. People with depression, we are now in the United States of America, and we are remembering some important people like the former USA President Abraham Lincoln, Winston Churchill in England, William James, a psychologist, very important to the psychology in general, and especially in the United States of America. The novelist Tennessee Williams, and the painter Vincent van Gogh. But we have many and many and many people with this problem. Anonymous and very famous too. We are pointing some aspects to our situation about the problem. So we can understand, like Spiritists, the idea of our earth and our mankind. We are like a semi-primitive world, and our diseases, our clinical and mental diseases, are always related to our moral and spiritual situations. We can work in this area, and it's not only one kind of understanding one relationship. We are dealing with this in our meetings, in mediumship, when we try to care of the patients with depression. So we are in the earth like a hospital planet, like a school for the spirits to guide or to give the opportunity of our development. We are ailing souls. We have moral vices. We can remember many facts that where we can see unrestrained selfishness, pride, vanity, obsessive passions, aggressivenesses. So we can see when we are treating one people with depression, some spiritual basis from the past, and from the past to our days. Here, I don't know if we can switch off for just a little second. We can remember some facts when we see our reality in terms of the consequences, of some kind of consequences of our moral difficulties. So we can see many things like them in the past too. And we can relate when important situation of our mankind nowadays and the big problem of depression. Thank you. If we treat or look for the causes of depression in some point of view, we have all the idea that all distinct illness has a spiritual basis. For example, if one patient suffers one acute myocardial infarction, we have one coronary obstruction because of a thrombus that cause the infarction. we can use the beautiful cardiology of the present days to treat and to disobstruct the coronary artery. But we understand that we have many other problems, because we can see one patient with coronary disease with many risk factors of atherosclerosis. But we can see patients with the same disease, the same acute heart attack, with no one of the risk factors. We can do some kind of medicine to the future that we can put the focus in other aspects of life, and not only in terms of the physical body. In terms of depression and in terms of other mental diseases, we can understand the idea that we are not dealing with some biochemical disturbance. We have spiritual basis to that genetic generated biochemical disturbances. So we understand that in the causes we have psychological causes, because we need to valorize the people with depression, its soul. So we have to do some understanding of the person with depression, the patient of depression disease. But frequently we have the spiritual influence of the spirits. I could tell you the idea that that when we open one case to treat, to care one patient with mental disease, including depression, always we have spirits linked to the case, especially from the past lives, but frequently too from the present. So in this approach, we need to care of the spirits related to the case too, to a better prognosis. We have many diseases, especially endocrine disease, for example, hypothyroidism, that we can see the relationship with hormonal deficiency and the symptoms of depression. But this is simple. When we recognize the problem, we can treat them, and the patient will frequently recover. But we are dealing in terms of statistics with other kind of problem, the spiritual problem of the patient. In terms of medicine, in terms of neurology, psychiatry, we have many beautiful things in terms of neurotransmitters, like serotonin, like dopamine, like norepinephrine. But this is consequences of the spiritual problem. But it is in this kind of cellular basis for the mental diseases that the drugs, antidepressive drugs, will do its contribution to the benefit of the patients, doing some kind of benefit and harmony and regularity in terms of the movement of the biochemical substances related to the neurons related to the problem of depression. When we enter in the idea of psychological aspects, we can see in dialogue with the patient some kind of ideas like unresolved dissatisfaction with oneself is very frequently, frustration about unfulfilled desires and or needs, but real or imagined needs, melancholy and lack of interest in life, escapism from reality which is perceived as hostile. In terms of a spiritual understanding of the problem, we could talk about that the main cause of depression stems from the spirit, the soul, and it is developed by the feelings we hold. These feelings are a reflex of our memory, which come up consciously or unconsciously and impact upon our current lives. Interesting, when we care the spirits in the spiritual realm, we can see our brothers and sisters in the other side of life with depression. If one patient discarnate with depression, they will go to the spiritual reality with the same problem. But in some period of time and with merit, they will be rescued and will be treated in the clinics and hospitals of that reality. We understand another spiritual aspects too about feelings and thoughts that may establish a communication with spirits, the feelings and thoughts of the patient with depression. So they may establish a communication, a tie with spirits that are tuned in the same wavelength, generating obsessive process that need to be treated with spiritual assistance. And this one is typical of the work in the spirit center. This obsessive process aggravates the symptoms of depression and delay recovery. So, if we do only the medical approach, the common medical approach with drugs and with some another facilities to the patient, we can see some kind of results. We can suppress the symptoms and benefit the patient. We need to do that. But we are outside the causes, because the causes are always of spiritual spiritual matter, spiritual importance. Another important issue for us is the depression in adolescents and young adults. Is the major cause of suicide in the majority of the countries worldwide. The suicide because of depression. In well-developed countries, suicide rates like USA range between the first and the third cause of death. In this faixa etária, age range, good. Very good. Thank you. Thank you. In this age group, we are in between the first and the third cause. In Brazil, youth suicide is the third leading cause of death. Here we can see the idea of our body, our physical body. In some kind of medical approach, because of conventional medicine, we only treat this one. We only can do some research in this one, because the doctors, the physicians, they don't know about the perispirit or the spiritual body or the soul or spiritual with eternal life. So in this approach, we can use drugs that they will act in this physical reality. But in the Spiritist approach of the depressive patients, we can treat where the symptoms and the problem begins, the soul or spirit. But we need to do something to this intermediate body, because the relationship between them that we can analyze in another lecture in the future, maybe. In terms of depression, we need to do some kind of distinction. The idea of feelings of depression, but we are trying to study now the illness of depression. Depression is a word which is often misused to describe how we are feeling. Everyone feels down from time to time. That is totally normal. It's not depression. It's some kind of changing of mood. But depression as a psychiatry event is an illness like any other, and it requires adequate treatment. We need to invite the patient and the family to be treated by the specialists that are the psychiatrists. Demanding that the person snap out of it or try to have fun in order to get rid of the negative feelings, it's not always helpful. But we try, it's spontaneous from our trying to benefit the patient. In terms of, not doctors, but in terms of our common relationship between people. It is important to listen to the person who is depressed. If you notice that they are not just sad, recommend that they seek professional help, because when we leave the patient with depression, in the future we can see the suicide. But we can see many other things, bad things too, like consequences. In terms of depression, is associated with a worsening of the quality of life, and also with higher morbidity and mortality. For example, the people with depression have worsening of quality of life in general. But if we analyze one conjunto, one group of one group of patients with depression, we can see more acute myocardial infarction in those groups when we compare with another group without depression. Depression is nowadays one risk factor for the coronary heart disease. Another aspect, when we study one group of cardiovascular disease patients, we can see that they will have worse prognosis when they have depression too. So frequently we need to treat the cardiovascular disease and the depression in the same time. So it's important to point that it worsens the individual's perception regarding their own health. So they will protelar. They will postpone. Good. Looking for the medical approach because of this lack of perception of ourselves in terms of diseases. We have one prevalence between 1 and 25%, depending the community that we are analyzing in terms of statistics. And we have a big problem because of suicidal tendencies, because depression. When we are treating them, when we dialogue with the patients, when we are doing the history of the case, individually, frequently we have the symptoms very variable, and the most common are loss of energy and interest in general terms for many to many things, depressive disposition, difficulty concentrating, alterations of the appetite and sleep pattern, slowing of mental and physical capacity, feelings of failure and regret, physical symptoms like abnormal awareness of palpitation, constipation, headaches, digestive issues, and other many things. It is common to have times when you feel better or worse. It is usually the depression can do some kind of oscillating evolution, and we can see different presentations of the patient between when they are feeling better and in other periods of time they are importantly depressive. It is usually a gradual process. All symptoms do not show at the same time. We can see in the same patient some kind of changing of the pattern of presentation in terms of symptoms. It is quite common for sufferers to come up with explanations as to what is going on with them, usually thinking it's just a passing thing. For example, I am like this because I don't like my job. Otherwise, I would be fine. But frequently, it's not the truth. As well as the main symptoms, some of these may also present trouble making decisions and starting tasks, difficulty finishing what has already been started, irritability, impatience, anxiety. Frequently, when I do this presentation, the people make some kind of linking between the symptoms of ourselves and the list of the symptoms. But don't worry, because this is normal, because we can have some of that manifestations because our reality. In terms of depression, we can see frequently feelings that life is not worth it, death wish, crying for no apparent reason. 2. Negative thoughts, pessimism, hopelessness, feeling sorry for oneself, unjustifiable guilt, frequently complaining, dry mouth, constipation, weight, appetite loss, insomnia, loss of libido. These are frequently symptoms in depressive patients too, but in the normal population in the same expression. When we are trying to identify the people, for example, like doctors, like psychologists, or in the fraternal counseling in the Spirit Center, we can detect them, asking them in terms of some important questions. Do you feel sad most of the day? Almost every day? No longer enjoy or have any interest in activities you used to like? Move slower than usual or have trouble keeping still? Feelings of hopelessness, worthlessness, blaming oneself for others' problems, feeling like a dead weight for the family? Thoughts of suicide is a very important aspect. Do this last at least 2 weeks at a time? This is some kind of criteria to understand the diagnosis of depression. When we have many things, but 1, 2, or 3 days, it's one thing. But when we have the same and we transpass 2 weeks to 2 months or 6 months, we are finding one patient with depression, because the criteria of time is very important. In terms of general interventions to benefit the patient, we can see in medical approach the idea of support, utilizing community centers for social reintegration, such as art groups, sports, music, sewing, woodwork, etc. We can use the idea of group therapy with psychosocial approach. We can see psychological support group, psychoeducation group for the family too, because always when we have one patient with mental disease, including depression, we can see the consequences to the family too. And we need to do some kind of approach to benefit the other people of the family. Medication, so in this matter we have a very big list of possibilities to use. And frequently one patient will receive one prescription of one kind of drug in one doses. And we need to see the patients many times to do the adjust of the medications. And we can change, looking for the benefit more impressive to the patient and to the family and to the doctor. The depressive problems in childhood and adolescence, frequently we have statistics. And we can see children with, in media, 1%, in adolescents, 4%, more or less. And this is a big one. This is a new recognition. Thank you. A new finding, because we can see the growing up of the statistics in terms of incidence and prevalence in those age groups. Here we have some differences. For example, poor school performance, because they are in childhood and adolescence. But we have another little difference too, and the people that are treating them know that very simple. This is another kind of problem, because depression is very common in the postnatal period. So in this matter we can see the same. It's very common to the mother to be emotionally different, crying frequently, and with some reactions because of the new situation, especially because of the first child, the first partum of that mother. So about half of women are afflicted by feelings of sadness and tearfulness during postnatal period. However, there is no harm in performing the task of motherhood, because this is important, because we can see the baby with risk of life when we can detect the big problem of one mother with depressive state, with major depression. It starts in the first days after delivery, 2 or 5 days. It lasts a few days to a few weeks, but in general is mild, and it does not require the use of medications. It's self-limited. We need to offer emotional support understanding and assistance in caring for the baby. But this is a mood reaction. But the postnatal depression, if initiated, occurs in the first 6 months after delivery. Diagnosis mistaken by fatigue and weariness because of the amamentação. Breastfeeding is frequently one problem that causes some tiredness to the mother. But we need to understand, because fatigue is one thing, depression is very different. And we need to observe, to recognize the depressive state, because of the risk of the mother and the risk of the baby. Its clinical presentation is equal to other depressions, that is to say prolonged and disabling. Requires appropriate treatment, psychological and medical and spiritual treatment too. If we care of the patients with another aging situation, like the people with more age, we can see many things because of the changing, because of the age. For example, physical aspects predisposing to the depressive state need to learn to live with the limitations. Social aspects, I don't know that. Change of roles, family, work and society, many change to the same people. Lack of social role, identity crisis, retirement, several losses because of the aging, money, decision, independency, autonomy, relatives and friends. We are frequently becoming solitary. Reduction of social contacts because of distance, money, dependency, time, violence, especially in countries like Brazil and Rio de Janeiro, but is frequently all over the world. Changes in aging, psychological aspects, difficulty to adapt to new roles, difficulty to adapt to rapid change, which has dramatic effect in the elderly. Need to work, organic, affective, and social loss. Low self-image and low self-esteem. Lack of motivation and difficulty of planning the future. Confrontation with their own finitude. Retirement because of some psychological aspects too. Psychological changes that require treatment. In terms of the elderly, about 30% of them, of that population, has some type of mental disease, of mental disorder, and depression and dementia are the most common mental problems, Alzheimer and depression. Now we will talk about some approach of the depressive patients in the Spirit Center. In the majority of cases in the Spirit Center in the world, we have the fraternal assistance. And we receive the patients to the dialogue, the fraternal dialogue. And in this dialogue, we can understand when the patient has or not the depression. So we need to train the workers of the Spirit Center who assist the people in the appointments of the depression problem. Basic recommendations for the people with depression, but with some kind of light depression. For example, to study the Spiritism, to understand the life, to understand the word and to recognize some own aspects that may be related to the problem of the depression, especially in this life, because normally we don't access the past lives. But Spiritist talks to assist them, workshops to receive the healing by the passes, receiving the spiritually magnetized water, the fluidic water, and to big cases or complex cases or very symptomatic cases of depression, we need to offer the disobsession to treat the spirits related to the case, because they frequently or maybe always are present, linked to the case. And the fluid energy therapy too. If we understand the idea of the medicine of the soul in the Spiritist approach, we know about the importance of disobsession, the same energy or fluid therapy, and some aspects to the prevention of the problem. We need to understand the idea, repeating, that the patient needs the psychiatry approach too. They need to be medicated during some time, while thank you, we are doing the Spiritist and spiritual approach. We don't substitute one thing to another. We are treating with the same, the two aspects of the approach in parallel. May I have the switch off, please? Thank you. Frequently, we do some kind of talk with groups outside the Spirit Center. So when we talk about mediumistic meetings, they don't know what is that. And we use this image, this drawing, to give to them one idea. So we have the table, we have the books, because all the people involved in the spiritual or mediumistic meetings need to be in constant study process. We can see the mediums, we can see one coordinator, and we can see spirits in the spiritual reality nearby the patients, the mediums working in the table of the mediumistic meetings. Here we can see good spirits inspiring the mediums and the coordinator. But we can see spirits in bad situations. And frequently linked to the case of depression or linked to the occasion of the case of, for example, schizophrenia, autism, and other mental pathologies. Thank you. The idea of fluidotherapy or fluid energy therapy, and we can use that in the Spirit Center in Brazil, in United States of America, because when we are working with this approach, we can use to do the transferring of magnetic fluids. We can see the reservoir or the spiritual reality to be concentrated to benefit the patients through the hands of the medium that are doing the application of the fluid. Application maybe?
Yes.
Yeah? Thank you. Spiritual fluid and vital fluid from the team that are doing the approach, we can see and we can observe the fluid donation applied by medium to someone in poor health, in depressive patients too. We need to put in action the willpower, or we need to do some kind of irradiation to the patient from the medium and from the team that are working together. When we analyze the fluidic effects, we can see, for example, in terms of all kinds of diseases, stimulation of body immunity system, disintegration of psychic residue, movement of physiological fluids on a person with poor health, activation of metabolism, activation and deactivation of the chakras. We have a new medical specialty like psychoneuroimmunology, because of linking between those areas of the human body and the human reality. It is the study of the interaction between psychological process and the nervous and immune systems of the human body that are very disturbed because of the problem of depression. Okay. Now, I will present like some kind of illustration of that approach by the mediums in the Spirit Center to the depressive patients. I select 3 cases and I will present to you, okay? Real patients from our recent experience. The study 1, the case 1, Débora, in Portuguese, 44, Brazilian, married and mother of 2, executive position in an international company in Brazil, Rio de Janeiro. Showed symptoms of depression, including the gain of weight over the past 6 months. 6 months of important depression. Had to take sick leave, insomnia, and ideas about committing suicide. Treatment based on strong antidepressants, showing no evident improvement by the psychiatry approach. And a very renowned specialist. Her husband took her to the Spirit Center, and this obsession and fluid therapy or energy therapy were recommended to her. When the group opened the case, all the mediums in the same time could see 2 spirits in fetal form, spotted, covered in blood, located next to the belly of the patient, near the solar chakra. Another spirit turned up and started to communicate through a medium, by dialogue, displaying deep hatred, as he had been murdered by her, as part of a provoked abortion in this life, looking for revenge and inducing suicidal thoughts in her mind. So we need to care them in the Spiritist context. Open dialogue with them, but in this case with only one of the spirits, because the other 2, they were unconscious. So understanding, support, prayer and education to that spirit in communication by the medium to dialogue with us. He was sent to a hospital in the spiritual world for treatment, and the 2 others have been taken away from the patient desvinculado,
Or
desligado,
detached.
detached of the case from the patient, and received a lot of benefits through fluid therapy. Re-energized and then taken to the same hospital but in a state of unconscious. The same spiritual hospital in a very high sphere of life in the spiritual realm. Deborah presented significant improvement in her depression, and in a space of 3 weeks she resumed her normal life. 3 weeks. Her psychologist reduced and ceased his psychiatry, reduced and ceased the medication. She was cured. Diagnosis: depression driven by obsession, caused by the victims of abortions, 3 of them, she had done in the present life. Frequently, the problem is in the present life. But it's easy to understand that it's very important the past lives, charging the health of the patient, of the people in this life. This is Leticia. Leticia, a 21-year-old law student in Rio too, started to present strong universal headache. Universal headache is in all the head. Universal because of this. Daily for 5 months. All medical investigation resulted negative, including high-image scans for migraine, brain tumor, encephalitis, etc. She took powerful painkillers with some benefits, but always temporarily. She became deeply depressive 3 months later. Then she dropped out of university and didn't leave home, spending days in bed with windows and doors closed. It's very frequently this one in depressive, important depressive patients. She was treated by the medical approach with antidepressants of many kinds. Her parents took her to see many psychiatrists who had no satisfactory results. Their neighbor suggested they went to a spirit center. In Brazil, it's very common, this kind of suggestion. This obsession revealed she was being tortured, especially in the head, by a group of terrifying spirits while she left her physical body while sleeping. Every night. In the mediumship meeting, we could see that she had been a man, and a Nazi official in Auschwitz-Birkenau, near Cracovia, Poland, the big one in Poland in the Second World War. He treated the prisoners violently and had tortured many of them, including some to death. Those who had not forgiven or forgotten her become revengeful. Him. Enemies of nowadays, persecuting their victim after identifying her in her current reincarnation because of the change of gender in the new reincarnation. The leader of the group of obsessors was brought in, and it was explained to him the reasons why they suffered during the war in the past. This motivated him to quit the persecution, take care of his own future, and invited to live in a better spiritual reality. He saw the sphere of a beautiful life and left straight away, taken by the good spirits. The other spirits were disconnected from the case by fluid or magnetic action and convinced by their leader to give up and follow him. Leticia received spiritual healing sessions for 1 month. Her health improved so much and the symptoms disappeared so fast that her family and neighbors wanted to know about what kind of miracle. After 3 months, the psychiatrist stopped her treatment because her recovery was complete. The third one, Antonio, Brazilian too, a 65-year-old retired chemist, diabetic and hypertensive, correctly treated for both with medication, started feeling symptoms of depression, but after showing great difficulty to walk because of diabetic polyneuropathy, very common, like a chronic consequence of the diabetes. He tried to commit suicide twice. A Spiritist relative took the case to a Spiritist center, and this obsession revealed that he was an old sorcerer that hypnotized people and ripped his victims off. Some of them had committed suicide because of misery caused by the evil actions of the wizard. In the past, obviously. Many old victims got together and hired an experienced Chaldean, yeah? Chaldean, good. Thank you. Chaldean wizard that inhabited the darkness and was able to hypnotize too. He then, acting especially during the victim's sleep, took him to regions where he weakened his strength, imposing suicidal ideas. The wizard was brought by force because he wanted to do that. By the spiritual team, constrained, went under specialized treatment, and he was disconnected from the case. The old victims were rescued, assisted, and invited to live in a higher sphere of life in the spiritual world, ascending in the spiritual reality, out of their forgiveness and forgetfulness. They agreed and were taken to a hospital in an astral city. After he started to walk again, he was able to go to the Spirit Center. The patient received the fluid therapy passes and obtained gradual improvement from the depressive symptoms. As soon as possible, as soon as he felt better, he stopped to take the medication on his own. He continued the treatment for diabetics and hypertension, and he don't have more the symptoms of depression. We use those cases to do some kind of illustration of the spiritual approach, Spiritist approach, but we understand that because of our big moral problems, we are predisposed to those problems, including depression. Maybe that nowadays we are in good health, but we don't know in the future. And we are Spiritists or spiritual interested in studying those matters. But we understand that in all over the world, the people don't know about this. And we need to spread the knowledge about those approach. So we need also to work some minutes about the idea of the prevention, because as you could see in those cases, we have one linking between our actions in the past or in the present life and the diseases that we have in each experience in the matter in the earth, on the earth. So we need to point and to suggest for ourselves the importance of inner transformation and thought education to a good life in the future. Cultivation of the soul virtues like altruism, pacification, solidarity, fraternity, charity, and capacity to forgive. We need to work to the people. We need to work without recompensation of every kind. But we need to work in our inner aspects. We need to work to benefit ourselves, changing our thoughts and doing the inner transformation. We need to put, for example, the Spiritist knowledge inside of us. Because it is important to know, it is important to study, but we need to do more, we need to change. Because now when we are depressive or when we have some cancer, we are collecting our bad consequences of our past experiences. But doing the prevention now, when we are doing our things, especially in the relationship with the people, we are doing some different semeadura, sowing to the future. And we will collect according to the sowing of those days. So the prayer and bond with the spiritual, the good spirits and the superior spiritual life. And we have some instrument to do that. We have the tools to do that because we are spirits and we recognize the value to do that. We need to look for the spiritualization of our lives. All aspects of our lives we can do differently in the future, like a cover with love, with feelings of high quality, especially in our work, in our family relationship, and in the society. We need to understand the meaning of existence and his significance to live our lives knowing what we are doing every day in terms of the future life, like a sowing to the future. We undertake and understand the divine laws, because when we study the Spirit's book, we can see the nature laws and the divine laws, and we need to know about that. But not only to know, we need to put in practice. Finally, I would like to do some simple considerations about the gospel according to Spiritism, because they can be useful to the patient and to the family with depression, and to prevent the depressive cases of the future. So the prevention of depression by the Spiritist education of children, teenagers and adults. utilizing Spiritism and the Gospel according to Spiritism for life cases of depression, to the patients with this problem. But to the other one, we need to suggest the fluid therapy and disobsession in complex cases of depression. Because if we don't do that, the patient will not recover in common therapy by psychiatry. How to apply the gospel in our lives? Because we can do the assimilation of fundamental knowledge of the moral teachings by Jesus to obtain the guidelines for our inner development. We need to do that too, including the teachings of Jesus in the current context of our lives. The gospel according to Spiritism, truth that will conduct us to freedom, in spiritual freedom in the future. Identify that the gospel according is the book of our life and will conduct us to freedom and happiness. And we have here one comment of the spirit of André Luiz, the same that you are studying, the same of Nosso Lar, so we can see he talking about the book like a sensitive analysis and reflection of the gospel, which gives humankind to understand and patience for life. Filling him with courage and faith, teach him to serve God through his neighbor and conquer the kingdom of God by understanding the truth. So, in this moment, I am finishing this presentation. I am very happy to be here with you. And if you have some comments, I would like to hear about you. Thank you very much.
Do you have any questions?
So my question is this on? It's on? Okay. So my question is, all diseases are spiritual causes? Like it's all moral and spiritual causes for all diseases? And then, if that's the case, so like the patient that had the hypertension and the diabetes, how come that wasn't also cured when he went to the Spiritist Center, since they were working with his spiritual body?
Okay.
Thank you.
Thank you for you. When we have a medical disease, maybe a clinical disease or a mental disease, when it is important, always we can detect spiritual problems. We can detect, for example, talking with the patients, collecting the informations about his life. But when we open the case in the mediumship meeting, we can see, like in those cases, we can see big problems of relationships in the past, in many lives of the same patients. And frequently, the same patients disrupt some kind of harmony in the community, interacting with the health and the quality of life of the people. So always when we have, for example, amyotrophic lateral sclerosis, when we have a stroke, or when we have one important pneumonia with acute respiratory failure, or we will have one acute myocardial infarction, or one autism case, or depression, or schizophrenia, or compulsive disorder. We have spiritual problems to treat, always. I don't have any case without the spiritual important situation. So the patient with hypertension or diabetics, these are some kind of karmic diseases in the physical body, because important transgression of the divine laws in the past, in the same. When we have a patient with lupus erythematosus, we have the same problems, but they are different depending of the case. For example, always when we have diabetics, we can see light clinical manifestations, but we can see a child with diabetics for all his life and with very important consequences. The spiritual situations between them are different, because they are related in terms of importance of the symptoms, exactly adjusted to the compromises in the past. So we need to treat the hypertensive and diabetic patients with energies and fluid therapy, with the disobsessions, because we will find the big problems unresolved, pending problems from the past.
Thank you very much.
You're welcome.
All right, we have a question here from Kirsten. And she actually is asking whether when you do your approach with your patients, if you recommend to them spiritual assistance in your medical work. Do
Yeah.
you do that?
I do that everything, always. Because frequently when the patient comes to me, they know that that doctor talk about many things independently of the medical approach that I do too, obviously. So if the patient are coming to me by the first time, but not recommended from other family or patients, I do the same. I respect the feelings, I respect the knowledge of the patient, the religion of the patients, because some kind of approach are not accepted by the majority of some kind of religions, but I do this always. And frequently, I lost the patients. Yeah? One consult, one visit to my office, and then to the Spirit Center. And they don't need to come back to my office frequently because of the results of that approach. And I become very happy because of that. Okay?
Once out of the clear, not too far back, maybe this year, earlier this year or last, it came to me very clear that mental illness stems to other lifetimes. That was very clear.
Traduz. Ele está perguntando. Yeah, it's very clear this linking between the past lives problems of transgression of the divine laws and the suffering of this life.
First of all, I would like to say your presentation was really wonderful for me, and your English is very good.
Thank you.
And
Thank you very much.
I have a lot of questions, but I'll try to think of just a couple, if that's okay. First of all, do you think that the whole spectrum of autoimmune diseases are karmic? And if so, why are they so much more prevalent today than the past?
Ela perguntou se que as doenças são kármicas, autoimunes.
Elas são kármicas.
Yeah,
A
always.
prevalência delas agora hoje em dia.
Always karmic?
Yeah, always. Rheumatoid arthritis, lupus, sclerodermia, and other. All of them are karmic. For example, I have patients with lupus that have many sufferings in many different organs and systems in the human body because she was a sorcerer in the past and used venom to envenenar, to poison her enemies. So she has some kind of consequences to her because of the hurt she causes in the past. She need to receive the consequences, to awake to some aspects of life. This is one thing regulated by laws. Always, when we have one clinical disease, for example, the autoimmune disease, we have problems in the past, pending problems, and we need to do some kind of approach to benefit the patient. We use the internal medicine approach, obviously, but we need to do that. To a good recovery of the patients. Frequently, we do not obtain the cure, like in diabetes, like in hypertension, but we can obtain the benefit with the patient with minus symptoms and a better quality of life, less medications, and we can see the difference.
I'll
Okay.
let somebody else ask a question, and if there's time, you can come back.
Thank you for a very comprehensive presentation.
Thank
I
you.
just wish you could be giving it to Shepherd Pratt Hospital, which is near here and services many mental patients. I'm trying to understand from the patient's whatever needs. It's not necessary that they learn about their behaviors in past lives or spirits in this life that might be coming back to get them. I know the mediums take care of that in the disobsession meeting, but in order to get well, I'm thinking the patients need to do the psychiatrist and come to the Spiritist Center, but they don't necessarily have to recapture those past lives. Is that right?
I think so. Can you translate for me, please, Vanessa?
Can you just repeat the last part so I can
Oh, I'm just concentrating on the patient right now and what their treatment plan would be. I know a strong linkage is past lives or problems in the current life that happened earlier. But in order for the patient to get well, they don't have to know what happened in those past
No,
lives.
they don't frequently because of some impressive aspects of the past, we don't reveal those situations to the patient, with some kind of exceptions. For example, when we have a patient with Spiritist knowledge, and we feel that talk to him about the problem will benefit them. But we need to choose what kind of people we will do that. We choose them. But in the majority of the cases, we don't do that. Okay? We register, but we don't talk to them. Neither to the family.
Thank you.
You're welcome.
Thank you. In the three cases you show us, the patients they were treated in the disobsession meeting, and the good spirits they took all the suffering spirits away to a hospital. This happened in all cases, or there are cases in which for Mary they don't deserve, let's put it this way, the patient don't deserve, I don't know to use another word,
Yeah.
This detachment from his or her obsessors.
Ela perguntou se sempre vão pro...
Se sempre vão e se no caso do paciente ele não merecer ou desligar, o que acontece?
All the spirits linked to the case and that are being visible to the mediums, we need to care of them, and we rescue them and guide them to one hospital or one kind of home to do some continuation of the approach, but not more by the team, incarnated team, but only by the spirituality. In terms of the merit, always when the patient arrive to their treatment, they have merit. Because if no, they will not arrive. Because unfortunately, in the majority of cases, they don't come. Because we have the opportunity to treat of some cases by week, but we have millions of cases. But in the future, it's our dream when we will have many spirit centers that will become to do that, and then we will see the spreading of some kind of light and love.
Yeah, 1 second.
Leo was actually asking you if you could elaborate a little bit more the connection between karma and the divine laws. Because you said something about it, he is asking if you could elaborate. Se pudesse explicar pouco mais sobre essa questão do karma que foi perguntado, e a questão das leis divinas.
When we study the divine laws in the Spirit's book, we can see many of them. And we can see the action-reaction law. The law of personal responsibility. So when we are doing something every day, we need to think about the consequences. And frequently in the past, when we ignore those consequences, we were doing all kind of things independently of the consequences, but always and all the consequences are registered to the future for us. We need to understand and when we need to be educated, and frequently the divine law of cause and effect will do some kind of comeback of the problem that we generated to the other people. So the problem of the suffering in humankind are always related of the divine laws. We have a Father of love, but we need to be educated, to growing up in terms of happiness, in terms of moral stature, yeah? And we need to do the better things during our recovery and during our progress in terms of moral presentation and reality. Okay?
Right. We have one more question.
Yeah, sure.
Yeah. All right. So yes, it's the last question.
And I also want to express my gratitude also and sincere appreciation for your talk and your learning and who you are. So thank you so much. So here's my question. Is it possible for people to do God at home and pray for the rescue of suffering spirits, and that would happen also that way? Like, do you have to be specific, or can you be general about it? And if you're going to, and can you be specific at your home and have it happen also?
Se a gente pode no Evangelho no lar fazer a prece e esse tipo de resgate acontecerem de modo geral durante o momento, ou tem que ser uma coisa específica?
A
Pode
very
acontecer
good and beautiful question, because this are the approach to the people that come to the Spirit Center. But the prayer and the gospel at home are beautiful mechanisms to help the people with some kind of disease, to help to prevent the spiritual problems for the future, to the team that are doing the meeting at home. But we understand that, for example, we can, like doctors and nurses, we can do some kind of prayer to the patient inside the hospital. We can do some kind of, with the prayer, irradiation of fields of love and fluids to benefit the patient in the coronary care unit, in the intensive care unit, in the regular infirmary. Do you understand? When we are doing some prayer independently of where we are helping the people, we don't need to think in that people with some kind of disease. When we are doing the prayer, we are irradiating to all the people. This is powerful, and this is beautiful. This is like a light in the spiritual reality.